Okay, good morning, everybody. It's now 9 a.m. So we're going to go ahead and get started just in the interest of everybody's time. I am Betsy and I'm here with my husband, Lance, and we are so excited to talk to you today about our MVP plans. So without further ado, I'm going to introduce Lance and he's going to talk a little bit about why we need MVP plans, what's so great about them, and why you can be the star of your business or your brokerage.
Hi guys, thanks for joining us today. Our contact information is right here, so go ahead and please take that down so you can reach out to us for copies of the presentation or any questions you have following our meeting today. I want to talk about a very unique product, and there are a lot of minimum value plans out there today. There are a lot of employers today that are looking to offer benefits. There are a lot of employers that have not offered benefits before. Understanding how competitive of a marketplace that we're in today, they know that they need to start offering benefits, but they can't necessarily meet the requirements of traditional health plans: 50% employer contribution, 50% participation from their employees, and they do struggle to offer traditional benefit plans. And that's one of the reasons we have alternative benefit programs such as these. We also have a lot of 1099 groups that we work with: construction, trucking, transportation, real estate companies that don't traditionally qualify for traditional health insurance programs and are able to qualify for our plans. We've also got a lot of traditional group business that offer traditional fully insured programs or have offered self-funded or partially self-funded programs in the past, but their deductibles, their copays, their out-of-pocket expenses, their employee experience is really struggling, and they're looking for ways to offer something new and to save money, especially with increasing wages. And that's one of the reasons that we've put together these programs, and they have been so successful. So let's dig right in and talk a little bit about the benefits and some of the things that are important to know about our programs. Number one, these are all no deductible plans. They are all copay driven plans. So even for things like hospitalization, maternity surgery, outpatient surgery, diagnostic x-ray lab, everything is copay driven. So employees don't have a deductible or a max out of pocket or any type of coinsurance that they need to worry about before their benefits kick in. And as Betsy goes through the benefits in just a little bit, you'll be able to understand exactly how they work. We do offer 4 different levels of MEC and 4 different levels of MVP. We are going to talk about our MVP plans today. They are available in all 50 states, and the rates are the same. There's no underwriting on these programs, okay? They are guaranteed issue with 0 underwriting. So whether you're in Florida, whether you're in California, whether you're in New York, your rates are going to be the same no matter what. They are guaranteed. I am going to show you rates today when we're done, and those rates can be sold to any group without requesting a proposal or a quote. Plans are ACA compliant. They are minimum value plans. They do meet ACA requirements to avoid both the A and B penalty for large employers. We do only need 2 lives to participate. Now, that's whether the group has 2 lives or 2,000 lives. We need 2 people to participate in our plans in order to offer our products to their employees. Again, guaranteed issue with no underwriting at all. We do have something unique as far as no employer contribution that is required. So the employer can contribute any amount that they choose or nothing. If it is a 1099 group, for example, it can be a completely voluntary benefit offering. We do have over 660,000 providers within a PPO network, so we do use a national PPO network, and that is something that's available and included in the programs as well. And it is level funded with fixed premiums, and there is risk mitigation. There is 0 risk to the employer whatsoever. So that's kind of the overview, and I know that's a lot of information, and we will have a recording of this available, but let's go ahead and dig into some of the benefits of the program, and I'm going to let Betsy go through those with you. We have 4 different options, and all 4 options can be offered in any given group.
Yeah, so like Lance said, it's a great product to be able to offer because you might have somebody who's not interested in maybe having that ultimate all the way plan, but is just looking at your basic plan. So the availability to be able to offer all 4 plans in one group is a great ability for you to be able to do. So like Lance said, the great thing about this plan is there's no deductible. So you will see that on the very first line there. There is no deductible. That is fantastic because you can start using benefits right away. You don't have to hit this max out of pocket for you to start seeing those benefits. As you can see, all preventative and wellness care are included. So that's your, pap smears, your mammograms, your physicals, anything like that is going to be included. Going down, you can see your primary care office visits are going to be that $25 copay on that basic, and then it's going to go down to 15, and then 20. You'll see right under there that there's 8 visits per plan year on that basic, and that plan, as you go to your right, increases. So you get 10 and then 12, and then that ultimate is our closest that we have to a true major medical. So it's an unlimited plan. You can go to your primary, your specialist as often as you want, as many times in a year as you want, and you're only going to pay that $20 copay for your primary care. Going down, same is for specialist office visits and all that kind of great stuff. You can see what your copay would be, how many visits you get per year. You do have urgent care in there. The other great thing about these plans is unlimited telemedicine. So during the pandemic, we really got comfortable with this telemedicine, calling up your doctor when you have an earache or a cough or something like that, and being able to be treated over the phone and have a prescription called in without having to leave the comfort of your own home. So this is a great service that is included with all of these plans. As you can see going down, we've got laboratory services and radiology included. That CT MRI right there with that copay of only $350 is pretty unheard of. If you've had to have a CT or MRI in the last couple of years, you know, we're talking thousands and thousands of dollars. So to be only held accountable for $350 is a great benefit for these plans. Allergy services are also included. So if you have some allergy sufferers or people who are dealing with seasonal or pet allergies, this is a great plan for them to be able to do. With all of these plans, you do get hospitalization benefits, depending on what you're looking for, is depending on what plan you would select. As you can see, that inpatient hospitalization for that basic plan, you're going to get 5 days per year for $350. Those days are going to go up again for each plan. You're looking at 7 and then 10 and then unlimited on your unlimited plan. These inpatient visits are included with your physician. Inpatient surgery is also included with a hospitalization copay. So the great thing is you're not going to get in a hospital and be racking up all of these different copays. You also have outpatient hospital and freestanding facility benefits. So if you are doing an outpatient surgery or something like that, you simply just need to pay these copays and get them scheduled and taken care of. Anesthesia is included, emergency room is included, ambulance services are included, and everything else that you could probably think of in a hospital is going to be included. The other really great thing that we love to promote with these plans is our pregnancy benefits. So if you have employees that are in their childbearing years and are having families, this is a great benefit to offer. I don't know if anybody's having a baby recently, but it is quite an expensive endeavor. So to be able to only pay a $350 copay is pretty incredible. And it's a $400 copay on that unlimited plan, but I don't think you can be paying $400 to have a baby nowadays.
Yeah, normal delivery is about $8,000, and with the traditional health plan, you're going to meet your deductible, you're going to meet your max out of pocket, and with us, it's a $400 copay for having a child, and that's again for being in the hospital for any reason whatsoever on that unlimited plan, $350 on the buy down plans.
Yep. So it really is a great service. And as you can see, we definitely have some other services included. We have some home health, some hospice on the upper end, and some different things in there. So chemical abuse and dependency. So it just depends on what plan your participants choose and what they are looking for. So we definitely have some built-ins there that other plans don't include. So it's a nice added bonus if you are looking for any of these different benefits.
Yep. And as Betsy mentioned, we do have prescription drugs in here, transplant, radiation, chemotherapy, all of those things are included in our unlimited plan. And then you'll notice there's a $5 copay for generic drugs. There's a $40 copay for preferred brand, $80 copay for non-preferred brands, and that is an unlimited drug card that is included with this program as well. So all of the plans do have copays for prescription drugs. And again, as Betsy mentioned, we do all have telemedicine included. It is free, it is unlimited, and it is included in all 4 of our different MVP plans. You can notice our costs as well. And our plans start with our basic and go up to our ultimate. You're looking at $400 a month up to around $561.84 a month for individual coverage. So extremely competitive with traditional plans that are out there. Again, removing the deductible, removing the copays, removing the out-of-pocket expenses, only 2 employees required to participate, no underwriting whatsoever. These are firm rates. So when you request a quote from us, these are the premiums that you are going to see every single time. So there is no surprise, there is no form fire, there is no underwriting. These
No
are the
age
rates that you're
banding,
gonna
no
see.
anything. So no matter where you are, if you have a group of with an 18-year-old and an 80-year-old, like we should talk about the 80-year-old, but anybody can be on these plans and the rates are not going to change.
Right. So any questions about the products that we've gone over today? If you'd like a copy of the presentation, if you'd like a copy of the Zoom today, those are all things that can be provided to you. You can reach out to us. Our email address, our phone number are both right here. I will take a minute and leave that open, and I will go to any questions that you guys have under the questions pane. So please keep yourself muted and go ahead and type in any questions that you may have into the chat box.
Well, it doesn't look like we have any questions. If anybody does have a question, go ahead and pop it in there. And if not, we will go ahead and finish up. We would love to hear anything you guys have questions on. Oh, we got one. Can a husband and wife qualify? That is our #1 question. Unfortunately, that is not a possibility. It has to be 2 separate households. So if it is a divorced husband and wife, maybe living in 2 separate households, but unfortunately a husband and wife does not count for that 2-person minimum.
Yep. We have another question. Any maximum per employee? There is not. So again, our unlimited plan is that traditional plan, but there is no maximum per employee as far as maximum dollar amount benefit paid. If they have $1 million claim, they have $1 million claim. So there is no max per employee.
Great questions, guys.